Has called an emergency meeting on Friday to decide whether the Ebola outbreak in the Democratic Republic of Congo poses an international risk. The virus has now reached the city of Mbandaka with 1 million inhabitants. At least 23 people have died from Ebola since April. There are fears that if it isn't stopped, it could spread to the capital and potentially into neighbouring countries. On Wednesday, more than 4,000 doses of an experimental vaccine sent by the WHO arrived in the DRC, with another batch expected soon. We're joined live now from Norway by Håkon Angel Bolkan. He's with the Department of Clinical and Molecular Medicine at the Norwegian University of Science and Technology. Good to have you with us. There's a lot of concern now that Ebola has moved from rural countryside areas into the city. What's your feeling about how fast it could now spread? Are we likely to see an increase in the number of cases?
Well, it's definitely a concern that it has spread to a city with such populous number, and it's too early to say anything clear. We need to know more of how the initial measures are taken, how they are working.
I know that you've looked at the impact of Ebola in other West African countries like Sierra Leone. How well do health systems cope in these kind of countries?
Well, I think it's this is the ninth case of Ebola in DRC, and they are familiar with the disease. They are familiar with the measures needed to take, and I think the world was clearly saw last time in West Africa the seriousness of those epidemics, and we have seen now that they have dispersed vaccines, and epidemiologists from the WHO are in place, and other organizations are also active on the ground. So hopefully this should be sufficient to contain this epidemic. But at the present state, we don't know, of course.
And what are your thoughts on the use of this experimental vaccine? It's very unusual to use an unlicensed drug in this way.
It's correct, and it's not licensed in Democratic Republic of Congo. However, it was tested quite, at least at the end of the outbreak in Guinea, and it turned out to have a very, very good results. And the way they are vaccinating this fence vaccine setup, where they are vaccinating contacts, it's you can also have then minimum number of vaccines, but the maximum impact of a campaign.
You mentioned that DRC has seen several outbreaks now. Each time health officials and the WHO act to try and get on top of it. Why does it keep coming back?
Because there is a natural reservoir in the, among monkeys and bats, and of course there will be people are exposed to those animals, and so we will continue to see outbreaks like this pop up. So the main thing is how the health system is able to contain it, and I feel that with the lessons learned from the West African outbreak, the international community seems to have been activated substantially this time.
Håkon, thank you very much indeed for joining us. Really great to speak with you. Håkon Angel Bolkan there in Trondheim in Norway. Now, the second phase of the